Welcome in and thank you guys for coming.
All right, we'll get started. Thank you for coming, guys. We are Group 5 of the Future Physician Leaders Program. We are a part of a program from UCR School of Med, and our purpose is to educate and bring awareness to the community on a pre-relevant topic, and our topic that we chose was endometriosis. My name is Sarah Gomez, and I have a BS from UCR.
My name is Serenity Patterson, and I have a Bachelor of Science from CBU.
My name is Bianca Hoyer, and I have a Bachelor of Science from CBU also.
My name is Jeanette Creo, and I'm an incoming second year at UCR, majoring in neuroscience.
My name is Jenna. I'm an incoming third year at UCR, majoring in chemical engineering.
Hi, my name is Ravima. I go to COD and I'm majoring in biology.
All right, that's our team, guys. We're gonna do a quick little activity. I know the word seems a little scary, or like not scary, but like hard to pronounce. So I wanted to see if anyone wanted to participate to try to say endometriosis. I put a little shortcut there. So if you feel free to unmute and try to say it. If you're a little shy, no worries. We understand.
Endometriosis.
Okay, thank you. So yeah, it's a, when you're not used to saying this word, it can be a little bit of a tongue-tied or tongue twister. That's what they call it. All right. So what are we going to be learning today? So we're going to go a little bit into depth of what is endometriosis, some potential causes, symptoms, some stigmas and barriers, and lastly, we're going to go over some available resources in the community. And then this is just a disclaimer. We are in no way providing medical advice. We're just here to bring awareness and educate you guys. So if you do experience any symptoms, please go ahead and seek medical attention. Okay, we have a pre-survey. If you guys can do us the favor of filling this out. This is just optional. You're not obligated, but we would appreciate the input and the data just for us to better ourselves, and we would appreciate it. Just let us know in the chat whenever you guys are done. Thank you. All right, thank you for letting us know. We'll go ahead and pass it over to Jana. She's going to go a little bit more in depth about what is endometriosis.
What is endometriosis? Does anyone want to unmute and answer? You can also put your ideas in the chat. Does anyone have ideas? It doesn't have to be correct. Okay, then next slide, please. So endometriosis is a common yet widely unknown disorder that occurs when uterine tissue grows outside of the uterus. Endometriosis is sometimes shortened as endo. As you can see from this image, this is what endometriosis looks like on a model. Uterine tissue is a type of tissue that should be grown inside of the uterus. And this specific type of viable tissue exits the uterus into other organs. It could be very dangerous and it could lead to endometriosis. On this model, the uterus is represented by the upside down triangle shape, as you can see. And if tissue grows outside of the uterus in areas such as the fallopian tubes and ovaries, as seen from the image, it could be irregular and lead to endometriosis. Many women with this disorder are unaware that they have endometriosis and therefore cannot receive proper treatment to relieve their symptoms. Treatment options vary depending on the severity of every case, and treatment options are available with those with endometriosis. And as you can see from the image, this is what it looks like on the model again. So before we continue to the rest of the presentation, does anyone have any questions on what endometriosis is or need further clarification? Okay, perfect. Next slide.
Okay, so these are the statistics for endometriosis. In America, 1 in 10 women between the ages of 15 to 44 suffer from endo. In California, that roughly calculates around 800,000 women between the same age group. And in Riverside County alone, it's around 121,000 women. Globally, there are 190 million people suffering from endo. Next slide, please. Okay, so these are some of the myths and facts about endo. I'm going to read them and I want you guys to guess if you think they're myths or fact. Please feel free to unmute yourself or just put it in the chat. So the first one is it's not easy to diagnose. Okay, I see a fact. Yes. So it is a fact. It's not easy to diagnose. It takes several years. It usually takes several years to get a diagnosis, and it can only certainly be diagnosed through a surgery. So the next one is extremely painful period is normal for every woman. Any guesses? I see a myth. Myth, yes. It is a myth. It's not normal. And if you do suffer from extremely painful period, it's suggested that you see a physician. The next one is symptoms are always present if you have endo. It is a myth. There is a thing called silent endo, and women who have endo may not show any symptoms at all. So the next one is endo can be treated. It is a fact. There is no cure for endo, but there are several treatment options like hormone therapy, surgery, and medications. The next one is women with endo cannot have children. Any guesses? Women with endo can have children. Around 30% of them are infertile, but there are treatments available for them, for those who are struggling. The next one is hysterectomy is a cure. Hysterectomy is when the uterus and other organs like ovaries and fallopian tubes are surgically removed. So is hysterectomy a cure? I see myth. It is a myth because hysterectomy, uterus can be removed, but the tissue, the endometriosis could grow in other parts of your bodies, like your lungs and your brain. So the next one is pregnancy is not a cure. I see fact. Facts, yes. So it is a fact. Pregnancy is not a cure. The symptoms may go away in some cases, but they usually tend to come back. And in some cases, the symptoms get worse during pregnancy. The last one is to avoid exercise. It's a myth. A healthy diet and good exercise is good for general health, but in this case, it could be a good way to cope with the symptoms. Next slide, please.
So some common signs and symptoms. It is important to be aware of common signs and symptoms of endometriosis so it can be identified early on rather than later on. As I have mentioned, endometriosis does not have a cure, but if you notice these symptoms and get a physician to check you out, you are able to seek treatments and just get ahead of it before endometriosis does get to a severe stage. So some painful areas that can occur is in your abdomen, in your lower back, and then some people may experience painful intercourse with their partner. And then there is some inconsistency with the menstrual cycle. So some women experience heavy bleeding, some just spotting, and then they do have a problem with constipation also.
So there are many importances of being aware of endometriosis. Does anybody know anyone with endometriosis? Feel free to type in the chat or unmute. All right, if not, that's okay. I didn't know anyone either for a while. One of my old friends, she actually just got recently diagnosed, and it wasn't until after many years of doctor's appointments for painful cysts, for even ovarian cancer. She had stage 1 ovarian cancer, and she just had her ovaries removed about a month ago. And it wasn't until after that surgery that she got her diagnosis for endometriosis. And if she had known sooner, she could have been free from pain, aware of more treatments that were available to her, maybe been more confident, because once people know what's going on in their bodies, they tend to be a little more confident that there's treatments for them and they can find support in others that are going through something similar. So thank you for attending our presentation, and please educate your family and friends. That's a great thing to do once you're aware of endometriosis as well. Next slide, please.
Endometriosis affects several aspects. Family planning and having children are affected by endometriosis due to pain during intercourse, chronic pelvic pain, as well as endometriosis affecting fertility. This may lead to decreased social interactions, withdrawal from social activities, and feelings of isolation. Decreased social interactions can also cause issues with mental health, causing depression, anxiety, and negative perceptions of self-image. Chronic pain also affects careers due to reduced productivity, frequent work absences, and reduced career growth. Next slide, please. Endometriosis.
There are many stigmas and barriers that occur in many different areas of medicine. It can occur with physicians, and it can occur with peers and family members even. So some things that can help get rid of those is becoming aware. Endometrial symptoms are often equated to regular menstruation, which is not true. Endometrial symptoms are typically much more severe, and the symptoms are often overlooked as well. So some people may express that they are having symptoms, but they might be brushed off or ignored, which is pretty unfortunate for that person. And some people also question whether it's real or not, because when you look at a person with endometriosis, you don't see a sick person per se. They look normal from the outside, but on the inside, there are lots of symptoms that are happening. Next slide, please.
Endometriosis is more likely to occur in women who have their first period before the age of 11, have a family history of endometriosis, have irregular menstrual periods that are more than 7 days, or have cycles that are less than 27 days. Next slide, please. The exact cause of endometriosis is not known. However, researchers are studying potential causes. Retrograde menstrual flow is a potential cause, and simply put means tissue shed during the period flows into the pelvis instead of outside, causing endometrial cells outside of the uterus that can grow and thicken. A weak immune system causes failure to find and destroy these endometrial cells, and surgical complications from C-sections or hysterectomies can cause endometrial tissue to be picked up and moved to other places by mistake. Next slide, please.
There is no way of strictly preventing endometriosis as stated before, but there are ways of reducing your chances of developing it, such as lowering the level of estrogen in your body. Estrogen is a steroid hormone which promotes the development of female characteristics in the body. As mentioned before, this hormone can be lowered by limiting the intake of caffeine and alcohol. Exercise in general is great for one's health and also helps lower the level of estrogen in one's body. Hormonal birth control is also effective, such as an IUD or the pill. Next slide, please.
And there are lots of treatment options available for every person. There are hormonal options, just as Jana had just said, such as birth control. There are pain medications to manage symptoms. However, it does not prolong the relief from the symptoms. It's not a cure. Surgery is another option. There are different types of surgery. You can do hysterectomy, which is what Ravima mentioned earlier, the removal of the uterus and possibly ovaries and fallopian tubes. There are also other surgeries available, such as laparoscopy, which is where they go in with a very small camera through a tiny incision, and they remove the endometrial tissue that has grown where it's not supposed to inside of the body. And women who are experiencing infertility as a result of their endometriosis can also receive fertility treatments. One option is in vitro fertilization, which you may have heard of as IVF, where the egg is fertilized outside of the body and then implanted back inside the uterus. And for those who don't want to undergo surgery or take any medications, there are also holistic options for people who want to manage their symptoms, such as turmeric for inflammation and acupuncture for pain. Next slide, please.
So if endometriosis is left untreated, many dire consequences can occur in the body. Each case of endometriosis is different, and thus treatment options will be different as well. No matter the severity of one's endo, it is always best to seek medical advice or professional advice before this chronic illness becomes more severe and symptoms intensify. There are 4 stages of endometriosis. Stage 1 is minimal, stage 2 is mild, stage 3 is moderate, and stage 4 is severe. I cannot stress enough the importance of obtaining some form of treatment for endometriosis because the symptoms do intensify and they do become very severe and very painful. Now, endometriosis is a whole body disease and it's known as one of the most painful conditions in the world. Endometriosis can result in the following complications, which could be fatal if left untreated. Endometriosis by itself will not be fatal, but it does cause complications that can be fatal. For instance, endometrioma tissue that usually lines the inside of the uterus is actually lining outside of the uterus, and it grows on the ovaries, the fallopian tubes, outside the uterus, the lungs, the heart, the brain, and intestines. If endo is not treated, there's a possibility of organ obstruction, painful cysts forming, as well as pain with urination, bowel obstruction, brain fog, and other symptoms as well. There is also a higher risk for thyroid problems, infertility, cysts, and an increased risk of ovarian cancer. Next slide, please. So to raise awareness in the community, one can fully research the condition and understand it well. We can also educate and spread the word of what endo is and how it greatly alters the quality of life of many women worldwide. In addition, we can start a social media campaign to help advocate for more government funding to find more efficient treatments that can really alter for the better the quality of life of many women who suffer from endometriosis. Next slide, please. So what can you do to support endo warriors and their family members? You can advocate for more improvements in medication options, as well as more efficient treatment options. You can also advocate for a more efficient diagnosis instead of the 7 to 8 years that it usually takes physicians to diagnose endometriosis. You can also advocate for physicians to be more aware of this severe chronic illness and pay more attention to patients so that they're more aware that perhaps they have some patients that are saying, I have these really bad symptoms, and to spread more awareness so physicians will listen to their patients. You can also form campaigns that strive for women's health care. You can also donate to organizations. You can spread awareness through social media platforms, and you can also volunteer at a women's health organization. Next slide, please. So here are some great community resources that are around the area. The first one is Planned Parenthood Coachella Valley Health Center. This is a nonprofit organization that specializes on women's healthcare, and they also specialize on providing advice for irregular periods, painful periods, or no periods at all. So that's a great resource. And then below that, we have Loma Linda University Health, Female Pelvic Medicine. They also have great resources to help support women with endometriosis. They provide laparoscopies, hysterectomies, hormone treatments, as well as pain medications. They also have pelvic floor physical therapy and muscle pain rehabilitation as well. And then next we have the Endometriosis Association, or the EA. This is a nonprofit organization and it's worldwide. They specialize in helping young girls and women find the right doctor to be able to help them manage their endometriosis symptoms. And then we have the Riverside Medical Clinic. They have wonderful family support groups, as well as support groups for endo warriors. And they also have a lot of great resources online as well for endometriosis. And then below that, we have the Healthy Women's Organization. This is also a nonprofit organization and it's worldwide. They seek to provide women with resources for their physical and mental health. Next slide, please.
And this is our post survey. So if you went ahead and you did the pre-survey, please go ahead and put the same name. Like I mentioned, this is optional. You're not obligated to do it, but we do appreciate you filling it out, letting us know what we can better ourselves, and just what you have learned overall. Thank you. Please let us know when you guys are done in the chat, please. All right, I see we have some messages, so thank you for those who filled it out. And then these are our acknowledgements. We just want to thank Esmeralda, Alejandro, and Jackie. They're our facilitators. They helped us a lot. They taught us a lot too, so we want to give them thanks to them. And then thank you guys for listening. Any questions? Right here you guys can find our Instagram, our website, our flyer, our brochure, so you guys can keep up with our information. Make sure to follow. Thank you guys.
And feel free to ask any questions.